This is an extract from the Leader Coronavirus Daily podcast by the Evening Standard and hosted by me, David Marsland. To hear the whole thing, search for it on your podcast provider.
Your right to go out for a walk in the park, the dog is getting on your nerves, fine. Don't infect me. You don't have a right to infect me. You must have a mask or a cloth covering nose and mouth.
New York Governor Andrew Cuomo is taking a tough stand against coronavirus and those who might spread it. Break his new law forcing you to wear a face mask in the state in public, and he's considering imposing civil penalties. In the UK, the masks became more popular as the virus began its spread, but there's division in the medical community over whether they work at all. I'm now joined over Zoom by Dr Babak Javid, who's both a consultant in infectious diseases at Cambridge University Hospitals and a professor at Tsinghua University in Beijing. Dr Javid, you want more people wearing face masks. Should the UK go the same route as New York and make it law?
Obviously, I'm not a policy expert, but I can tell you from a scientific perspective, because the maximal benefit of the population wearing masks is if most people wear it, measures that increase compliance would definitely improve the benefit, because the benefit is mostly from protecting other people, not protecting yourselves. If a minority of individuals are wearing masks, we're only going to see very, very minor benefits from population mask wearing.
But there does appear to be a confusing message from the scientific community. Some people, including the government's own advisors, say that masks are not necessary and they don't work.
We have to look at the precise language that's being used by both the UK government and the WHO. What they are saying is that there's no evidence to support use of face masks. And I'll hold my hands up and say that when we look at the scientific evidence, it's not compelling. But there's also no compelling evidence for hand washing, in fact. So if we're willing to go down one behavioral route to minimize the impacts of COVID-19, in the absence of evidence, we're arguing that the same should apply for face masks. There's a good scientific rationale for face masks. And in the absence of evidence, that doesn't mean there's evidence of no benefit. They're not the same thing.
I was not aware that there's no evidence for hand washing.
So what we can say is that the evidence for hand washing is flimsy and no less flimsy than the evidence for wearing face masks. There's some studies that show benefit and many studies that don't. And in fact, studies that have looked at face masks combined with hand washing are the most consistent in showing benefit.
Assuming they do work then, as you say, how do face masks work?
So there are two potential mechanisms. First of all, I should say that almost all studies with face masks have been using surgical masks. There's a little bit of an extrapolation when medical masks are limiting as to how effective cloth masks will be. I'm just going to be honest about that. But one benefit, and this is really important in a hospital, is to protect the wearer from incoming droplets that might contain infectious virus. For that, you really need high quality masks, which won't be available for the general public. But the second benefit is to prevent people who are shedding virus that are just in normal breathing or coughing or whatever, transmitting virus either to other people, into the air, onto surfaces, from reducing that shedding. And there's actually quite good evidence that even cloth masks are pretty effective at that. So it's really to block transmission. And more evidence is now emerging that the maximum amount of viral shedding in patients with COVID-19 is actually happening just before they show symptoms such as cough or fever. So if we're only asking people with symptoms such as cough and fever to wear a mask to protect others, we're actually missing the boat on where it might have maximum effectiveness.
There has been some reporting about risks of wearing masks and dangers of wearing masks. Are there any dangers?
So I think that we need to categorize these in a couple of different categories. The first one is the issue of complacency. If someone wears a face mask, they might not do other behaviors or measures such as physical distancing or washing their hands. And I think that can be solved by education in the same way that people in the 70s said you shouldn't wear seatbelts because it'll make people drive recklessly, or we shouldn't use condoms in the 80s because people will be more promiscuous. These can be solved by education. The other issue is about contamination of masks, that if a mask is contaminated and we take it off and we then don't wash our hands, we're going to risk contaminating ourselves and surfaces. I think that's a real issue. But again, that can be solved by education. And the second point that's not being discussed by some media outlets is that if your mask is contaminated, by definition, it's already done its job and protected you. Because how can it be contaminated? It can only be contaminated if there are infectious droplets that would have otherwise touched and gone into your mouth or onto your face. So I think we have to be just honest about these issues and then treat the public as mature individuals that can weigh up the evidence for themselves.
There are some people who kind of have an issue with wearing masks themselves. They fall off. They're not that easy to use, though, are they?
I think that that's very fair. And I have to be honest that, when I'm out and about wearing my own mask, going shopping or whatever, I do see some people wearing masks, but they're constantly touching their face, adjusting their mask, all these things. These things can be solved by mass education campaigns. Who would have thought 3 months ago we would have had 400 ads a day telling us how to wash our hands? We just assumed people would know how to do it. Why can't we do the same thing for masks?
Could you see the UK becoming a nation like South Korea where face masks are commonplace now?
I think that we have to be honest with the public. And I think the public is currently confused. I think we have to say this is mostly an altruistic act. And I think actually the British public are incredibly good at thinking about others. If we say that this is really going to be beneficial only if we all unite, we're actually much more likely to see a public response.
Search for the leader Coronavirus Daily on any podcast provider to hear more from the podcast.